Hello everyone, today we are going to learn about paraffin bath. It is one of the occupational therapy interventions in the area of orthopedic and surgical condition.
So what is paraffin bath? It is one of a heat agent modality where we apply heated molten paraffin wax and mineral oil to part of the body. The component of paraffin bath machine include a stainless steel tank, which will not corrode with the heavy use and meets the highest standard in sanitizing, a high heat warning light and low heat indicator light to indicate the temperature of the bath if it is higher than safe and comfortable for treatment. And also we have precise temperature control, which operate with maximum temperature with variation of ±1. Next, we have paraffin, which is a white or colorless soft solid wax. It is made with saturated hydrocarbon with a typical melting point between 46 to 68 degrees Celsius. It has a low thermal conductivity, high heat capacity, and insoluble in water. And lastly, we have mineral oil, which is used to lower the melting temperature of the paraffin to a point of which it can be used safely with patients. The ratio of mineral oil to paraffin suggested are 1:7.
The purpose of paraffin bath divides into two, which is therapeutic and cosmetic. For therapeutic, it is used to provide pain relief to sore joints and muscles. Other than that, it helps increase blood flow, relax muscles, and decrease joint stiffness. It also minimizes muscle spasms and inflammation as well as treat sprains. For cosmetic purpose, it often used in skin softening serum and spa treatments. It helps open pores and remove dead skin cells. It also makes skin look fresher and feel smoother.
So next, we move on to indication and contraindication for paraffin bath. Paraffin bath is suitable to be used for patient who has hand osteoarthritis, carpal tunnel syndrome, thicker vein tenosynovitis, rheumatoid arthritis, keyboard user, fibromyalgia, and scleroderma. Fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Scleroderma, also known as systemic sclerosis, is a group of rare diseases that involve the hardening and tightening of the skin. The contraindication for paraffin bath, it is not suitable to be used for patients who have poor blood circulation, numbness in the hands or feet, having any rashes, open sores or open wound, having defective skin sensation, which is the inability to judge correctly hot and cold temperature differences on the skin, having ischemic condition where there is a very poor blood supply to an area, having skin allergy, and lastly, having diabetes where there is a likelihood of a reduced sensation.
Now let's learn how to use the paraffin bath. To lower the operating temperature, turn the adjusting screw counterclockwise. The solution should be mixed with mineral oil with a ratio of 1:6. We cannot rely on the light alone to determine whether the bath is at operating temperature, so always check using a thermometer. And make sure that there is paraffin in the tank before operating the unit, because operating an empty tank may cause heating elements to burn out. Intervention procedure. Firstly, ensure that the temperature is between 125 to 127 Fahrenheit, which is similar to 51.7 to 52.8 degrees Celsius. Patient need to remove all the jewelry before starting the session. The hand will be dipped into the wax up to 10 times and allowed to sit for 2 to 3 seconds. It will help to build up an adequate layer of warm wax. After that, cover the hand with a plastic bag and a towel. The wax can remain on the hand for about 15 to 20 minutes or wait until the heat has gone. Remove the towel and the plastic bag, then peel the wax back toward the fingers. The wax can be discarded, or if only one person is using the unit, it can be replaced in the bath to melt again. However, the wax will be replaced after several uses as it will gather some dead skin cells, thus making it unsafe to use. Lastly, don't forget to continue the session with exercise at the affected joint for at least 10 minutes after the procedure. It will help to increase the effectiveness of the intervention. These are the ways to clean a paraffin bath after using it. We need to turn the high heat switch on for 55 minutes and wait until the temperature rises to about 100 degrees Celsius. Make sure that all paraffin is removed and the bottom is cleaned completely.
The first evidence-based study, entitled Paraffin Bath Therapy in Decurvent Syndrome Tenosynovitis, a single-blind randomized controlled trial, aimed to study the effectiveness of paraffin bath therapy on pain, muscle strength, and quality of life among patients aged 18 to 65 years old. The procedure included 10 sessions with 5 days per week for 2 weeks. The result has shown that paraffin bath combined with a spica splint and exercise was more beneficial than a spica splint and exercise in managing the symptoms of decurvent tenosynovitis. Paraffin bath therapy seems to potentiate the effect of spica splint and exercise.
The next evidence-based study by Ordahan and Karahan in 2017 is about efficacy of paraffin wax bath for carpal tunnel syndrome, a randomized comparative study. The aim is to investigate the effectiveness of paraffin therapy in patients with CTS. For results, using splinting alone is an effective treatment in reducing symptoms in early stage, while for paraffin treatment with a splint increased recovery in functional.
Hope this video helped you guys to understand more about paraffin bath. That's all from us. Thank you.